Yeah, so when we designed our integrated urgent care service, we put a lot of time and effort into thinking about how patients would move through the service as a whole. We weren't just looking at the benefits of co-location, which are certainly real and apparent to us, but we really wanted to concentrate on the patient's journey, how they would move through the service from their first contact point, be that through 111 or via walking into the urgent care centre or ED, and think how we could most effectively streamline that journey so that we would avoid unnecessary ED attendance, but also make sure that we added value to the patient's care either through their experience of a home visit or through the urgent care centre. We put a lot of time and effort into engagement with our inpatient specialty teams so that when we designed the pathways for sort of onward referral through the urgent care system, we would try to avoid unnecessary ED attendance and move people on to the area of definitive care as quickly and effectively as possible.
Personally, I would say there's less volume of patients coming to A&E now that the urgent care centre's open. The right people are coming in that should be in the emergency department. Medical staff, consultants are giving their expertise, time to patients that are poorly.
I'm one of the nurses who works on streaming. We do this so we can streamline patients to the appropriate centres of care. Since doing this, I think it's worked out really well because patients know now where to go because we're directing them in the right area of care.
I think it's really beneficial that the urgent care centres come next door to us because it means we don't have to send people half a mile down the road to Stockton for the urgent care centre. And I think that it's beneficial to get people at the right place at the right time. They can be seen quicker, and it means that A&E can concentrate on people that have got minor injuries that can be seen quicker next door.
Since the urgent care service has opened at North Tees, we're getting the correct patients in the right area. So I've noticed a big improvement with the communications through the two departments.
The more sick patients present to the emergency department and we have some more time to look after them properly. It's some extent we're not as overwhelmed in terms of numbers as we used to be and running around all over the place trying to catch up with things. It also means for our junior doctors they have more support within the department because I now have more opportunity to review cases with them and things like that. Also they have more opportunities to complete some of the assessments they should have done during their period with us.
So I think the benefits that I've seen since the urgent care centre opened is that we've certainly had a reduced number of patients, and that's due to the fact that patients with minor injuries and minor illnesses are now using the urgent care centre as opposed to coming into the emergency department. Essentially that means the staff who are in the emergency department can deliver care more swiftly and efficiently to those that need that care, so the right patients are in the right department.
It's actually been quite beneficial in terms of it's allowed our caseload to be relieved of the things that maybe we were tied up seeing, ankle sprains, back pains, things like that. It's actually given us time more to triage the frailty eligible criteria on people here in the department. Gives us a lot more time to spend doing initial assessments on people and identifying what their needs are so that we can start the process of therapy and social input a lot earlier than normal. So we've seen our caseload go up and coincide with the use of the new frailty tool here in A&E and then onwards throughout the rest of the hospital. So the patient's journey is accompanied by a therapy team from the front of house all the way through to discharge.
Whilst the implementation of the integrated urgent care service has been embedded, part of my role was to support the emergency directorate in the PDCA projects in NHSI and Action on A&E. We've done that. We implemented lots of PDCA projects. Staff embraced them. Part of the reason we had to do that was we had to meet this 95% standard, and we weren't doing that on a daily basis. We implemented lots of PDCAs, time to initial assessment, hospital at home, triage, streaming, pathways, and it was a whole system approach, not just with our directorate but all the other directorates and support staff. I think when we first started the programme, it was a journey of 1,000 miles, and we had to take that first step. We took that first step, and I think we've took a lot of steps since then. We are on the journey, we're still on our journey, but I think it's exciting. We've made significant improvements, we've had fantastic patient experience and compliments, and we continue to strive to be the best we can for our patients and our staff.